Thank you very much for allowing me to talk about breast reduction. I enjoy doing breast reduction. It has one of the highest satisfaction rates amongst women. Many women with large breasts are bothered by shoulder pain, neck pain, back pain. They can see the bra straps dig into their shoulders and they just feel uncomfortable. It's harder for them to exercise and they really want a breast reduction. And once they have it, they feel great about themselves and are really happy they did it. So I really enjoy doing this because there's so much patient satisfaction. This is one of the procedures that I always do in the operating room. I prefer to put you asleep. You'll always see me before the surgery. I'll draw lines on your breasts, and at the console, of course, I'll explain how I do it. Once you wake up, the operation's done. There's different techniques for what kind of breast reduction, what kind of incisions I use, and that's best discussed at the consult. So when I see you for a consult, which is done in the office, I'll always go over everything, listen to what your concerns are, find out how much breast tissue you'd like to remove. In almost 100% of the cases when I do a breast reduction, you'll also get a lift at the same time. What's nice about doing breast reductions is the scars usually fade out very nicely. They're virtually always covered by a bra or a low-cut bathing suit. It's only until you can see your areolas that essentially the scar can be seen, and for 99.9% of people that means a very select crowd get to see that. Afterwards, you can return to work after the surgery, usually between 7 and 10 days, sometimes 14 days, but 7 to 10 days is a good number. I have you up walking right away, I have you shower the next day. I usually let you start exercising around 10 days, but again, that will be discussed with you at the time of surgery. Anytime I remove breast tissue, it will always be sent to the lab to be checked, and usually that part will be covered by your insurance company. I don't take insurance companies directly, so the vast majority of patients will just do this as a cosmetic procedure. Occasionally patients will have out-of-network benefits and I can occasionally work with them, but that's something my office can determine for you. If you're considering a breast reduction, I would encourage you to make an appointment. It's a free consult and I enjoy talking to you about them, and I'll examine you and give you all the ins and outs and answer all of your questions at the time of surgery.